Welcome to Health Currents, a look at the services, programs, and people of Riverside Medical Center. And today we are joined by Dr. Juan Jimenez. Dr. Jimenez is a neurosurgeon with Neurosurgery Consultants of Riverside. Dr. Jimenez, welcome. As a neurosurgeon, tell us a little about the procedures that you perform.
Neurosurgery is a specialty that deals with conditions of the brain, spinal cord, and peripheral nerves. So as such, the surgeries that we perform involve all three of those areas: brain tumors, hemorrhages, congenital conditions, hydrocephalus, and the like.
So they would be just be disease states, but also trauma, I'm sure, is a big part of what
Absolutely, especially with the warm weather right now.
Yeah, talk a little bit about that. Over the summer months, you're seeing more of that?
Well, we see trauma year-round, but more so in the summer. One of my pitches towards the community out there is helmets, both for kids and those riding motorcycles or motorbikes. So those tend to be common, and then work-related falls, etc., and motor vehicle crashes. Those sometimes, by no one's fault, can unfortunately occur.
Sure.
But we deal with the whole gamut of injuries that can involve brain and or spine.
Now, I understand Riverside has technology that allows you to do many of your procedures in a minimally invasive way. Talk a little bit about what minimally invasive, what kind of techniques those are.
Yeah, that's the concept of less is more. I see many patients when I examine their back, their incision is literally a foot long. But we can now accomplish the same type of surgery through an incision less than an inch in size. Wow. So the idea is that there is much less trauma to the body, and that allows us to carry out the surgery without disrupting the normal anatomy, sure, which has many impacts. It can help facilitate the recovery of a patient, decreases the pain, diminishes the hospital stay, diminishes the blood loss. Sure. And you add all those factors together, you're going to decrease the complications related to surgery. So it's a minimal approach with a maximum return.
Sure. I would guess the recovery and then their ability to get back to doing the things they enjoy has to be shortened because of that minimally invasive.
Absolutely. I just interviewed a family right now after surgery, and they related to me their story of surgery over 20 years ago and 2 weeks in the hospital. Now, right, today's day and age, we cannot spend so much time in the hospital, but the majority of our spinal surgery, either the neck or the lower back, are done on a same-day basis. So that allows us to, by decreasing the hospital stay, you increase the mobility of the patient, and the patient can get back to what they love to do, or get back to their usual activities. It's really, for us, quality of life, allowing the patient to get back to life and enjoying the things that they like.
Doctor, before we ask our final question, we're going to jump over and get a Health Currents update from Judy.
Thanks, Carl. As Dr. Jimenez mentioned, there are plenty of bicycle riders and motorcycle riders out on the streets. So please be sure to be careful. And if you are one of those riders, make sure you're wearing your helmet. June is a busy month here at Riverside, so join us for the Men's Health Forum on June 13th with Dr. Slutsky. He'll talk to us about male erectile dysfunction and urinary incontinence. Join the American Cancer Society and Riverside Medical Center as we team up for the Relay for Life. Join us for Iroquois County's Relay for Life on June 8th. and for Kankakee County's Relay for Life on June 16th. And on June 20th at our Coal City campus, be sure to join us for our Diabetes Wellness Open House. And back to you, Carl.
Doctor, in 2011, Neurosurgery Consultants of Riverside was distinguished as the #1 spine surgery program in Illinois. Congratulations.
Thank you. Thank you very much.
You don't do that without a great team. Talk about the team at Neurosurgery Consultants.
Yes. No, this has been, a true honor and distinction for our group. 5 years ago, 6 years ago, there was little, if any, neurosurgery done in the community, and now we've been honored with this distinction. It's truly, I mentioned earlier, interdisciplinary approach, but here it's truly a team approach. Part of the distinction that we received, in my opinion, is attributed to our less invasive surgical techniques. Wow. Patients go home quicker. Mm-hmm. They don't get complications, and that's what the basis was for that distinction. So it was a true honor to be named the #1 spine center in the state of Illinois by Healthgrades. And I think it speaks to the excellence of the care that we firmly believe in, and that, as you said earlier, we couldn't do it alone. Sure. without a team. Yeah.
Now you and your partner, Dr. Charles Harvey, are operating in the new East Tower, and the new operating rooms that are in the East Tower. Brand new facilities. That has to be a nice environment to be working in.
It's a beautiful facility. You can actually see
that's right.
part of it in our background.
Right.
And the best part is the river view.
Yeah.
But no, it's truly state-of-the-art. The facilities there, it was a great project to be involved with as a surgeon, because our input was taken into account to design the layout of the operating room. Obviously allows us to carry out the complex surgeries and procedures that we do.
You do the great work that you're doing.
Thank you.
Dr. Jimenez, we appreciate you joining us on Health Currents. And I'll tell everybody to stay current, stay healthy, stay tuned to Health Currents here at Riverside Medical Center.